so much more on Zoom than I ever wanted to have to do.
Oh, I'm telling you, it's a different age that we live in right now.
I am very much looking forward to having a classroom full of live students, and
I don't blame you.
I went to the grocery store yesterday and it was great. I was like, oh, I can't wait.
I am with you. Well, we're finally at a point where we're we don't have to wear masks at work anymore. I carry one just in case clients are wearing masks, but it's about, I would say 70% without, and it's so nice.
Yeah. So me and I know Ms. Velez and another biology teacher, we've been really advocating not wearing them. Although I will say I didn't get sick at all this year.
You know what? Me either. And so there is something to be said for that.
Yes, yes. So, but we've been like, no, if you're vaccinated, that's the whole point behind a vaccine. So we're trying to put our money where our mouth is on the whole
Yes.
vaccine piece. So hopefully.
Hopefully the days are coming when we return to some form of normalcy.
Yes, I very much am looking forward to that. All right, so I have sent them the link and they will generally tell me when they are on.
Okay. So Jennifer, do you have students there in person then, or is everybody going remote, or how's that working?
So we have, we're doing a hybrid model right now.
Okay.
And finish out the year this way. And so some students are present in the classroom and some students are still accessing remotely. And
Okay.
so it makes your job very unique because you're teaching to a computer at the same time you're teaching to actual live people. So sometimes I'll forget that I am on mute, and I'll just go into it and everyone in the classroom can hear me and they're acknowledging, and then someone will send a message, "Miss, you're muted." And I'm like, okay, so let's start over again. Or sometimes I'll be talking directly to a student in the class and I didn't mute. And so everyone at home is like, what are you talking about? And it's like, no.
Oh, yes.
So
the challenges.
It's an interesting new world. So that's the thing I'm most looking forward to. Just being able to teach one group at one time in front of me. It's going to be amazing.
Absolutely. Absolutely. Oh,
all right. Well, they are here. So let me
okay.
go ahead and welcome the other classes. Good morning, Mrs. Velez and Ms. Tran and Mr. McNeely's classes. We have Dr. Trish Hessel visiting us today, and she is currently a veterinarian. And from what I know through talking to Mrs. Velez, she has a very interesting path that she followed in her biological career. So remember, we want you just to kind of see all these different career paths that you can take with it, following biological sciences, and that there's so much more than just being a nurse, and we want you to see all of the different things. So without further ado, let me go ahead and turn it over to Dr. Hessel so that she can tell you all about her exciting career journey.
Hello, everybody. Oh, and Ms. Tupp, I just want to make sure, are we recording this session?
Yes.
For future? Okay, wonderful. Okay, sounds great. Well, guys, I'm going to go ahead and get started. I've got a PowerPoint presentation that I'm going to go through that just kind of highlights a little bit about myself, my path to becoming a veterinarian, and then I'm going to talk about what a typical day looks like for me, some of the different cases I may see, and then going to talk a little bit about, your education to become a veterinarian, what that involves. Also talk about other career opportunities within veterinary medicine, talk a little bit about salary, and then I want to leave some time for sure for questions that anybody may have. And so without further ado, I'm going to go ahead and get started. So my name is Trish Hessel, and pretty much when it comes to, hey, what career is right for you? It's a path, it's a life path. And that's kind of for me what it's been. So when I was around you all's age, which is many moons ago, but when you start to get into, middle school, junior high, into high school, people start to ask you, well, what are you going to do? What do you want to be? And so there's a lot of pressure sometimes to decide. And so when it comes to kind of like how did I decide what I was going to do? So when I was in high school, I played basketball, and I was very much into athletics. And at that point, people are asking, well, what are you going to do? What are you going to do? And I had an uncle that was an attorney, and I thought, well, hey, you know what? I could be a lawyer. I could do that. And so that's kind of, I just decided that that's what I would do. And I didn't really do a lot of, shadowing of attorneys, other than, knowing my uncle was an attorney. I didn't do, a lot of the job shadowing that's available now, which I wish I would have. So kind of what I did is I went to Iowa State on a basketball scholarship. And at that time, since I had already decided, hey, I'm going to be an attorney, I did all of my class focuses on kind of liberal arts, or liberal sciences, so not really biological sciences. And I was a political science major, and I did minor in history and sociology. And after I graduated, I went on to the University of Maryland, and I went to law school. And I decided while I was in law school, I don't know if this is really what I want to do. I started doing, some internships in the summer, and decided, I don't know if I can do this for the rest of my life. This is not really what I thought. I loved animals at the time. So what I tried to do is do a little bit of work in animal law to see if that would fulfill my desires. And it didn't. I thought, oh, I don't know. It's sitting behind a desk a lot of the day. And so I kind of decided then that, hey, we adopted a dog, my husband and I, and she had a lot of health problems. And I was at the veterinarian's office a lot with her. And I thought, God, I really love medicine. It really interests me to read up on all of her different medical concerns and medical problems. So I kind of decided while I was in law school that, I really like medicine, and I really, really love animals, and I really like veterinary medicine. So while I was in law school, I started working at a veterinary clinic, part time there. Knew that golly, that's what I really want to do. This is where my love and passion are. And so I made the plan then that one day I'm going to go to veterinary school. So I took a little bit different path. Um, so what I'm going to do is kind of go through, kind of how do you decide what you want to do? And it took me a long time to kind of get to the point of knowing what it is that I wanted to do. So what I would encourage you guys to do, explore the things that you love, find something that doesn't feel like work, something that you want to get up and do every day. Because when you get into the world of working and having to support yourself, and it's a majority of your time is spent doing your job. So let's talk a little bit about what does it take to get into and go to veterinary school. So focus on science and mathematics. That's kind of a very important piece of the puzzle. It does require a 4-year undergraduate degree with certain prerequisites, and a lot of those are very heavily science-based, your biologies, your chemistries, getting into also physics. And so then there is, of course, a math component to things as well. Veterinary school is a 4-year degree. And so I'm going to kind of go through here what veterinarians do before you even get to applying to veterinary school. There is a lot of schooling that is required, but if you love the math, if you love sciences, math is a little component. I'm not a huge lover of mathematics, but I will tell you the sciences. I've always loved biology. Chemistry was interesting, but I really more liked the biological sciences. Biochemistry kind of combines both biology and chemistry together, and that was a little bit more interesting than just your basic chemistries. So at any rate, what do veterinarians do? So we work to prevent disease by keeping the animals that we care for healthy. Okay. When they do get sick, then it's a diagnosis of, hey, why are they sick? Why don't they feel well? And then we have to figure out what they have in order to treat the disease. And so what makes it really challenging is our patients can't talk to us. So a lot of it is, a really good physical exam, kind of like you see the picture here of trying to discern on exam, hey, what part of this puppy dog doesn't are they responding to, like they don't feel well. So animals are a huge part of everything I do. And I hear a lot of times people will tell me, "Oh, I really don't like people. I think I'd like to be a veterinarian." And I will tell you, there are some veterinary jobs that don't necessarily require you to work too much with people or the public, but all of the animals that I see that come in, they come with owners or pet parents. And so it is a lot of dealing with people. So that's just a little side note. Average salary, what are we talking about? So depending on where you're working, what part of the country you're in, it's around 75,000 to 125,000 for veterinarian salary. There are a lot of job opportunities. The field is right now. I'm in the Houston area, and there's a shortage of veterinarians. There are many jobs open. Emergency veterinarians are in hot demand right now, so it's a really wide open job market with a lot of different options, which we'll go through a little bit. So where do I work? I work at Lake Olympia Animal Hospital, and we are a 9 doctor veterinary practice. And we see, I will go on to the next slide, different patients. So primarily dogs and cats. We do have one veterinarian that sees what we call exotics, or our non-furry critters. So tortoises, reptiles, birds, snakes. So we do have an array of patients that come through the doors. We do not do large animal, but there are plenty of veterinarians that do large animal work as well. So what does a traditional veterinarian do? So working in a veterinary clinic, kind of keeping our pets healthy, which would include vaccinations, dental care for them, and surgery. And we're just going to kind of start with kind of what one of my days may look like. So I pretty much get into work at about 7:45 in the morning. I start to see my first patient at 8 in the morning. So before I even start seeing patients, I may have patients that are hospitalized. So I would look in on them, kind of make sure they're doing okay. And then kind of what might happen is I have a dog brought in, and let's say the dog is coughing, not feeling very well. And so then you kind of have to ask a series of questions. Well, okay, has this dog been exposed to any other dogs? Has it gone to doggy daycare? Has it been boarded? What about grooming? Because I want to know, is that cough, could it be something that's contagious, right? That could affect the other patients that are coming into the clinic. And so sometimes we do have a room for isolation, where I can isolate a patient that could potentially be contagious to other patients. So then that starts a whole series of questions that you're interacting with the pet parent on. And so whenever I have a dog that comes in for coughing, one of the things in our area that is very prevalent is heartworm disease. And so if I've got a dog that's been coughing and really doesn't have a lot of exposure to other dogs, but let's say hasn't been on any kind of a heartworm prevention, one of the things I may do is do a heartworm test. And that's what's kind of pictured on the right side of the screen here. And so this test, if I see kind of a dot on the right side, kind of like we're doing here, that tells me that this dog is testing positive for heartworms. So heartworms are really kind of nasty things, that spaghetti-like worms that live in the right side of the heart. And they kind of live in a kind of a pulmonary artery, and that is an artery that connects the heart to the lungs. And so the irritation and inflammation from the worms in the heart causes the dog to have inflammation in the lungs, and that can result in a cough. So first patient, heartworm disease. So we go through and we have our diagnosis, then it's talking to the owner about what are our next steps to be able to treat this dog for heartworms. So next appointment on the schedule might be a little puppy dog like this, that maybe the owners are breeding. Okay, so they're expecting, and you can kind of see this little girl has a very swollen belly here. Her nipples are developed, and so what we're going to do for her today is take an X-ray to see if we can kind of see how many puppies she may have. So uh, this is an X-ray of our little dog here, and her head is sitting to the left, and her back end, you can kind of see where her hips are. I don't know if you can see my pointer, but kind of towards the back end here. And then you're seeing a bunch of little spines, and this is a head here and a head here and a head here. And so X-ray, not, I can't always, I tell people that there could be another puppy hiding underneath what we're seeing here, but it gives us at least an idea of how many babies they may be expecting when this little girl goes into labor. And so that's appointment number 2 of the day. Then we have a dog rushed in through the door that, oh my gosh, he was just, owner was the dog got out, they were chasing the dog was hit by a car. Dog comes in not bearing any weight on one leg, and we have a fracture. And so that, again, diagnosed by X-ray. And you'll see that what was done to kind of correct this fracture was to have a plate put in. And so when it comes to surgeries like this is something that we would refer to a specialist, a surgeon, to fix. There's certain fractures and things that we can do in our clinic, but the more complicated fractures like this, you can see that the bones aren't even aligned. We've got different pieces. That's a little bit more of a specialty surgery. So that would be something that we would refer. And we'll talk a little bit about specialists and because there are a lot of different opportunities, job opportunities. So let's go on. So another thing that we do is dentistry. So this little puppy dog here has some really heavy tartar on her teeth. And you'll see that I can't even see the back teeth because they're so covered by tartar. And whenever we have buildup like this, we can start to get infection along the gum line. So all of this is our dental cleanings and things are all done under anesthesia. So you guys will see she has a little tube coming out of her mouth, and that's delivering gas anesthesia to her lungs along with oxygen. Because unlike us, you cannot have a dog where you're saying, oh, can you hold still for a little while, turn a little bit to the right, and be in the mouth scaling the teeth with an ultrasonic scaler like they do for people. And it's very similar to what is done for people in terms of we start with dental x-rays, just like they do for us. And then we go in with an ultrasonic scaler like they use at our human dentist. We take all that tartar off, and then we polish the teeth, same kind of technique as they do for people. And the end result is we come out with some pretty nice looking teeth. So kind of the before and after. And so that's kind of another little part of our day is doing some surgical procedures. And a lot of that involves it's dentistry, spay neuters, growth removals. That's kind of what we get into in some of our surgeries. Skin is another big part of what we see, or dermatology. This little dog here, you can already tell, you look at it and you're like, oh my gosh, that dog must be miserable. Look at the skin, the hair's missing, it's swollen. It really, this dog is super, super itchy. And so with this little puppy dog, I do a little bit of a skin scrape and look at things under the microscope. And what you're seeing here are a bunch of Demodex mites. So these are little mites that you cannot see with the naked eye. It requires a microscope. But these are the culprit for causing this dog to be very, very uncomfortable, easily treatable. And within a couple of months, the hair will regrow, the swelling will go down, and this dog is going to start to look like what we would consider a normal puppy dog again. So a large part of what I do spend a lot of time looking at things under the microscope, and that can be looking for ear infections, looking for bacteria, yeast. We look at urine under the microscope, a lot of skin cytologies. And so Microscope work is really important part of what we do. We also do aspirates with a needle of different growths like lumps and bumps to see, do we see cells that look ugly or cancerous, or more of a benign characteristic. So for those of you that really like working with a microscope, that's also something large part of my day. I spend a lot of time looking under the microscope. So this is, I think, my last case. This is a puppy dog that came in. The owners were noticing that this dog was having accidents in the house. There was a little blood in the urine, and there were some concerns that she was drinking more water, kind of squatting to go more frequently than when they walked her. And so we did take an x-ray here, and hopefully you guys can see my pointer. This is lungs, kind of towards the left side of the screen if you guys are looking on, and then hips are back here. Liver, these are our small intestines and large intestine coming through. This is where the bladder is, and there are a bunch of stones in the bladder. And so bladder stones are sometimes able to be dissolved by diet. Other types are not dissolvable by diet, and you have to go in and surgically remove them. And that's called a cystotomy. And so that's, again, another, using x-ray. The other thing I would be looking at is some urine on this puppy dog to see kind of what that looks like. And sometimes you can see crystals in the urine that are indicative of certain types of stones. So this case right here would be kind of a combination of tools to get a diagnosis. The other thing I would look at doing is taking a urine sample and sending it off to have a culture and sensitivity done to make sure that we don't have infection present, because that's going to kind of guide antibiotics, whether they're needed or not needed in some cases. So a lot of different components that go into kind of our diagnoses of cases. So what kind of career options are available for veterinarians? So I'm a general practitioner, and kind of what I've shown you is a day in the life of kind of what a general practitioner might do. But there are a lot of different career options for veterinarians, and all of our career options still focus around prevention of disease, the diagnosis, and then the treatment. And so I'm going to kind of go through, as I told you, I'm a small animal veterinarian. There are large animal veterinarians as well that are dealing with, horses, cattle, goats, sheep, so they have a whole different array of patients that they see. Then there are career fields within zoo medicine and exotics, research and laboratory settings. So a lot of the things that are developed in terms of human drugs sometimes start with animal models. And so there are a lot of opportunities in laboratory and in research settings, and that can be in the at universities. It can be at private companies. So a lot of different options there. Let's go on, and I kind of mentioned educational settings. So teaching, and that's, veterinary school. We have a lot of veterinarians that are employed at the veterinary schools that are teachers and helping the form and educate the veterinarians of the future. Animal shelters and rescue organizations, whole nother area of opportunity. We've also got disaster and emergency response. Okay, and kind of see this horse being lifted out of a dangerous situation. Food safety is a whole nother area within veterinary medicine. There are many veterinarians that are looking at our food supply, making sure that it's kept safe. They are also looking at animals that are being brought into the country to make sure that they do not have diseases that they're carrying that then could be spread to other animals within our country. Then we have specialty areas within veterinary medicine. I'm just going to kind of go through a whole list here. I already kind of alluded to one area, and that's surgery for that fracture that we saw. But there are, if you think about human medicine and the different specializations that are available there, the same kind of holds true now for veterinary medicine. So we have anesthesiologists, surgeons, people that do internal medicine, dentistry, behavior veterinarians, emergency and critical care. We've already talked about zoo. There's equine only, or horses, where people specialize only in that field. Clinical practice, which is what I do. And then we have veterinary nutritionists as well. So there's a whole different, specialization areas. With the specializations, that is requiring additional schooling for those. And it's just kind of like human medicine. You go on and you do, residencies in various fields. So then there are, if you all have animals, you may have already known about having, you go to a specialist in specialty hospitals that sometimes house all of these specialists under one roof. There are military veterinarians as well. So not only are they helping protect people from the transmission of disease from animals to humans, and protecting the food supply, but they're also caring for the working dogs that are aiding our troops. And they kind of, again, one of the big things is a defense against foreign and emerging diseases. And so when you talk about different illnesses and things that can be passed, some of the things that in the COVID is one of those examples, is you're really looking into where did COVID come from? Bats. Did it originate in bats and then was transmitted from bats to people? Was it something that was in a lab that was then spread from a laboratory setting? But there are different diseases that start in animals that then mutate and can be basically spread through human contact, and those are called zoonotic diseases. And so there's a lot of different ways that human medicine and animal medicine interact. And so that's a whole nother area of, research, availability of job opportunities. And that's a really growing field as we learn more and more about how different viruses and infections can mutate and go from people to animals and from animals to people. Beyond vet school. So if, maybe you're like, oh my gosh, that sounds like many, many years of schooling. I don't know about all that. There are other opportunities within veterinary medicine that is, does not require a veterinary degree. So we have veterinary technicians or veterinary nurses that are invaluable to what I do every single day. I couldn't do what I do without having the assistance of my excellent veterinary technicians. And we've got, there are research assistants, there are people that help run veterinary clinics and veterinary schools. So if you're interested in kind of a job that has a science component to it, but you're also interested in business, there's a good overlap in many different fields within veterinary medicine for people who want to stay more on the business side of things. Veterinary technician, kind of start with that. They kind of think of them as a nurse. They help us in the treatment and care of the animals that we see every single day. And I'm going to kind of go through this a little bit here. When we talk about, and we kind of covered this in the beginning, really we're focusing on education and preparation for careers in veterinary medicine. The sciences are really, really important. Okay. And as I already kind of mentioned, chemistry, your biologies, mathematics, those are kind of the thing that we want to get a really good, solid background in before we even start applying to college and looking further, is kind of starting that process early on in high school when you have opportunities to. That kind of concludes my presentation. Do you all have any questions for me?
Oh, we definitely have a list of questions for you. So,
Okay.
um, so the students would really like to know what is the most interesting story you've ever had on the job?
Most interesting story. Let me think about that. Golly, there's so many there are so many interesting cases that come in. Okay, so one of the ones that was really kind of interesting to me is there was a puppy dog who came in and had been vomiting, and so we treated this dog for vomiting and didn't take any X-rays initially because the dog really wasn't very sick. And then it got better. A couple months later, comes in vomiting again. And we're thinking, well, what on earth is going on with this puppy dog? And the people had a young child at that point, and so with the second episode of vomiting, dog wasn't feeling very good. So we went ahead and we took an X-ray, and very clear on the X-ray was a pacifier, that this dog had eaten the baby's pacifier, and the pacifier had gone missing it had been missing for several months. And they're like, my gosh, we never could find that. And the baby got off the pacifier because we could never find the pacifier. Well, this dog had eaten it. And what had happened is it, it was obstructing at times, and then it would move and it would allow things to pass through. Then it would shift and the dog would start vomiting. So that dog went to surgery, and we had to remove remove the pacifier. Um, Golly, I just saw a dog the other day that had a tumor that when we took it off, it weighed about 10 pounds. This was a 100-pound dog. And so it was kind of the size of a bowling ball. And that was a really interesting um, surgery when you're removing something that large. That's not an everyday occurrence. So there's a lot of I'm going to tell you, there are so many interesting cases like this that you never really know what you're going to see each day coming in. And so those are kind of some of the interesting ones. There's all kinds of really cool cases that we see on a daily basis. That's for sure.
I can only imagine. I think my dogs would probably provide they eat everything. I'd want to eat a cell phone.
Absolutely. And that's another thing. Whenever you go into surgery and the dog has been vomiting for a while, there are so many things that come out of the intestines of dogs. So of course, bones. Don't want to feed your dogs bones, guys, because that can lead to blockages. And so we pulled underwear out, tennis balls, toys, little miniature soldiers. Think about anything a dog could put in its mouth, or a cat. Cats are notorious for eating like the scrunchies, rubber bands. There was one cat I think we did surgery on, and he had eaten, like 20 little hair ties. So it's never dull, and you never know. Pecans, that's another thing that I had did surgery, and I pulled a pecan out of a little dog. It's always it's never dull, and the questions are always like, what is this? And the owner's like, oh my gosh, we were missing a part of a stuffed animal. That's where it went. Yes.
Okay, so how do you work with an animal that's sometimes hard to handle? Because I have one who is not, she doesn't know her manners. So I definitely would be interested on.
Yeah, so that's always a challenge. That can be a challenging part of the job, is those dogs and cats that are aggressive or will bite or are very fearful, because some animals will bite out of fear. So you have to be really, really careful in how you handle them, because the last thing you want to have anybody have happen is my nurse or my technician to get bit, I get bit, the owner gets bit. All of these things are things that you definitely want to avoid. So a lot of it is gauging each individual patient when they come in. Some you can tell are just fearful, and they may just do a little bit of growling, but they're not necessarily going to bite. Then you have some that you walk in the exam room and they are outright lunging at you. And you know that that's an animal that, okay, I'm not going to be able, when you walk in and a dog is lunging at you and baring its teeth, and the only thing keeping it from kind of attacking you is that the owner has a hold of it on the leash. That's a dog that I know I'm not likely going to be able to examine without sedating the dog. Okay, so there are some dogs that, in cats, that if they're aggressive enough, or there's no way that we can put a hand on them, um, I will send them home with some medication that we can try that will maybe just take the edge off. There are some dogs and cats that there is no way they're going to be handled unless we give them anesthesia and completely knock them out. And so a lot is just really watching the patient and how they're reacting to you in the exam room, and also how well can the pet parent help you in handling their particular dog. And you guys, I'll be honest with you. I had a dog. She's since passed, but she was aggressive. I mean, mean aggressive. And there were things that I had trouble doing to her, even though she knew me. And so for certain things, I knew she was going to have to go under anesthesia, like her ears. If she had an ear infection, I'm not going to do that with her awake. So there are different levels of medications that we can use to kind of help us to be able to manage and treat some of those patients that are grumpy.
Um, what is the most interesting animal you've ever worked with?
So before I went to veterinary school, I did whale and dolphin work in Galveston here. And so I did a lot of rescue and rehabilitation with various marine mammals. And so I think my favorite is, I love manatee. And we don't get a lot of manatee in Texas, but I did go when I was in veterinary school in my last year. I did go out to Florida, and I was able to work with manatee out there, and that was kind of just doing some health assessments on some of the different wild manatee. And so in terms of like, oh, what I really liked working with them, and that's probably the most interesting critters that I've worked with are going to be your manatee and your dolphins. And then I'm trying to think of others that I've seen. I like opossum, and so I get into some wildlife work and rehabilitation that I think is really interesting as well. So there's all different types of critters, but those are my favorites. They're the ones that are the most unique or interesting, I think.
So one of the things that I'm sure is probably one of the hardest parts of your job is when you lose a patient. What are some of the ways that you cope with, and how do you help your clients cope with losing their pet?
Yeah, so that's probably one of the things that I hear a lot from pet parents and from people that just are like, oh my gosh, how do you deal with losing a patient, or how do you deal with having to put a patient to sleep, all of those things. So yes, it is a difficult part of the job, and I look at it this way: is that many of these patients are very, very ill. And unlike people, we have the ability to end suffering for them. People have an understanding of what's happening to them. So if you have ever had anybody with cancer, and a human can understand why they don't feel well. Animals don't know that. They just know, I feel lousy. I don't want to eat. I don't want to drink. I don't want to get up and move around. And so when I look at it from a standpoint of I can help and suffering for this animal, still difficult to do, but something that I can help with. When it comes to the loss of an animal, that's like losing a family member for many people. And I think the hardest ones for me when it comes to like end of life and having those discussions are people that, elderly people, that this is their companion, and this is the only, thing that they share, day in and day out. Or the other thing that's really hard are the ones that come in where it's the mom and dad bringing in a dog, and it may have been their son or daughter's dog who has died, and they've taken over the care of this pet, and it's kind of their last remaining connection to that son or daughter. Those have been the most difficult for me. But I tell you what, it's something that there are a lot of resources in terms of like grief support, and things that there's animal hospice and palliative care. So when you think about veterinary medicine, it's usually, I would say, about 10 to 15 years behind human medicine. Okay. So hospice and palliative care for our patients now is really becoming kind of a new, I shouldn't say new, it's probably been around for like 10 years now, but it is becoming more and more developed, like in-home euthanasia, or putting animals to sleep at home, and having veterinarians that will come into the house and provide like hospice care like we do for people. So that's it's a developing field. It's one I'm really interested in, because I think, being able to provide pain support, pain care, support, comfort support for these animals in their end of life, is really, really important. So yes, very difficult area of what I do, but it's one that I will tell you people are the most grateful for, that you can be there for them, in that kind of hour, I would say hour of need.
I've heard that the home hospice and the home euthanasia is actually really helpful if you have multiple pets too. So like if you have
Absolutely.
two dogs that have grown up together and one just is sick, it's a lot more helpful for the one that's left behind.
Absolutely. For them to be able to kind of be there, and all. And I think, well, I'll be perfectly honest, for me, one of the best things about becoming a veterinarian. So before I was a veterinarian, because I didn't go to veterinary school until I was 40, which I know to you is going to sound like ancient. Okay. So, wow, she was really, really old when she went. So I was older when I went, and I was probably not quite the oldest in my class, but very close to it. And so one of the things for me, I had numerous pets. I had many cats and many dogs. And for me, one of the hardest things was having to take them into the clinic to have them put to sleep. And so when I became a veterinarian, I will say the best things for me is I can put my dogs and cats and animals to sleep at home. And I think for people, that is one of the life saving. I mean, it makes them a lot more. It's just a, it's sometimes a better environment for the people and for the pet. And so I've done many at home euthanasias, um, and more that's being offered. And I think for many people, it's really, and for the animals as well. It's a really, really good option to have.
All right. So you had mentioned earlier in your PowerPoint something that we are really trying to drive home to students, that if you find a career that you love, you don't actually work a day. There are days that I feel like I'm working and like it's coming to work, but those are the days I'm doing paperwork. I'm turning in grades. I have meetings. Those are the days that feel like work. Days that I just come in and I just teach and I work with kids and we're just talking about science all day. I don't feel like it's even work. Like it's wonderful. So you did give them some good advice in that sense of, if you love what you do, you'll never work
Yeah.
actual work a day. It's something you're enjoying and passionate about. What's another piece of advice you could give to a high school student who's, just started their biology trek and is now opening their eyes to all the different pathways that are available?
Yeah. So I think the big thing when you're just starting that biology track, and you're kind of starting out and you're learning about different biological systems and in different careers, like this is a wonderful you know option that you guys have, to have people come in and speak to you about different careers and different options that are out there, is explore them while you're young. Okay, so try to find, if you have an interest in something that it piques your interest, and you think, oh, hey, I'm really interested in, you know, I don't, a forester. I really, I really want to see what it looks like to work on a national forest, or I want to see, whatever piques your interest. Try to find somebody within that field that you can go and spend a couple days to see what do they actually do. And now with the internet being what it is, you can do a lot of research online about different careers and different options. And don't be afraid to ask people, because I think the biggest thing and the things that are so nice now is there are a lot of options, things for younger people to be involved with, to kind of seek out, hey, do I really like this? Is this something I could see myself doing as a career for the next 40 or 50 years that I may be working? And that's a long time, guys. When you're talking about, the years of your life that are spent working, it's a long, long time. And so what made me decide at the, age of, I don't know, 30 or 40 or whatever, that I'm going to go back to school and do something different, was because I was working with people that are like, they were trudging in every single day. And they're like, I've only got 20 years till retirement. 20 years? Oh my gosh. 20 years is that's a life. That's a long period. You guys aren't even 20 years old. What I'm saying is that's a long time to be doing something that you don't really love. And so finding what you love. I mean, gosh, if you love working in the yard and the garden, and you love, hey, maybe you want to do landscaping. Maybe you want to do, there's just so many different options out there. And so trying to job shadow, spend a day with somebody to see what they actually do. Because I will tell you this, if I had done that in law when I was in high school, and I had kind of seen what some of these lawyers were doing day in and day out, I don't know that I would ever gone to law school. And that was a lot of years of education. And I don't regret going to law school, because it has been very helpful. And I spent 10 years working in the legal industry and doing that. But I will tell you that explore while you're young, and you don't have to make a snap decision about, hey, I want to be this. And don't feel like once you commit to something, that's what you have to do for the rest of your life. There are, we have it's actually, our lifetime is not really, really long, but it's long enough for us to be able to do several different things. So if you commit to something and you find out, I don't really like this, have a plan B, have a plan C. Because what I find a lot of times is I have people that come in and shadow in veterinary hospitals, and they really love it. And then they get into what the prerequisites are to getting into vet school. And I will tell you, it is very hard to get into veterinary school. It is, I have heard this said, and I do believe it, that it's harder to get into veterinary school than medical school. The competition. So first off, there are only, I think now there's maybe 27 or 28 veterinary schools in the United States. Not every state has a vet school. We're fortunate here in Texas, we have 2 now. But the competition to get in, most of these schools are admitting maybe 130 students. And there are, for some of these spots, 700, 800 applicants. So check into what's required to become whatever it is you're interested in, and set goals for yourself. Because what I have found is people really love veterinary medicine and they want to be a veterinarian, but the grade requirements, the competition is very, very stiff. So if and let's put it this way, I'm in high school, I love math, I love science, I'm really good at it. Grades are important, okay? So when you go on to college, hey, if I'm not planning on going, to additional schooling, whether it's going to be in, whatever industry it may be, the competition, grades are important. So making sure that you keep those grades up. And when you go to college, and that first semester can be tricky, really, really tricky. And so people often will have, they may fail a class or 2 or something. I'm going to tell you, it can set you way back if you start with a very low grade point average. So just knowing that ahead of time, I think for some people is really helpful. And so that, I guess, would be my advice is do some research into what's required of whatever career you're interested in so that you know what it takes ahead of time for me to become, a mechanic, a beautician, a veterinarian, a scientist, whatever it is that you're interested in. Just having the background on that industry, that field, and what's required is really helpful. Sorry, that was a really long answer.
It was perfect. I remember one of my professors told me C's get degrees, but they don't get you in grad school. So it's important to really be mindful of those grades when you're in college, because they will come back to haunt you when you are in your career and you think that MBA is a good idea, or the master's degree is a good idea, and you just skated through. So it's really important. And then the other, I like that you said that you don't have to do the same thing forever. And as somebody who at 40 is going into a PhD program, I 100% agree with you. Like, you don't have, once you get into something, being in a career might expose you to a career you never knew existed, and that you have to just go back and start again. So don't be afraid. Don't feel like you're stuck because you made one decision. There's always more decisions that can be made. So I really appreciate the time that you took to be with our kids today.
Thank you.
It was wonderful. So thank you very much. You guys, if you have any questions, just let me know or Ms. Velez know, and we will definitely pass them on to Dr. Hessel and see if we can get more information for you.
Thank you all very much for allowing me to join your class today. I really appreciate it. Good luck with your future.
Thank you, Dr. Hessel. Have a good day.
Thank you. Bye-bye.
Bye.